I was asked to talk about cost efficiency aspects of CEUS in liver lesions poses questions which are almost impossible to answer and to which there are very, very little available data. And I may add that I'm a radiologist with specialty in oncology, but I'm no economist. So we have to try to approach this theme with some amount of common sense to see what it is about. So if we talk about colorectal cancer, the first question is, what are we recommended to do? Is there a place for contrast-enhanced ultrasound from what we can draw from the guidelines? And if we look at the guidelines, you can see that there is digital rectal exam, there is coloscopy, biopsy, there's abdominal ultrasound, just normal B-mode ultrasound, but no CEUS, no CT of the abdomen, no diagnosis which cares more about the liver than does just normal B-mode ultrasound. There's chest X-ray, serum CA, and not routinely recommended CT or MR of the liver, only in special, not further defined cases. In rectal cancer, I may add that there is additional high-resolution MRI of the pelvis required to determine the local invasion, but again, this does not take care of the liver, so this is the opposite. How is it in the aftercare of patients operated for colorectal cancer? In stage 1, there's nothing. The patients just go home and see their family doctors. In stage 2, there are regular history, physical, CA every 6 months, abdominal ultrasound, again in B mode every 6 months, rectosigmoidoscopy every 6 months, coloscopy once after 3 to 5 years, and one abdominal CT done once after 3 months, covering the entire abdomen, and which is usually made to have a baseline for further follow-up studies in case anything arises later. No chest X-ray done for these patients. So, what are we going to talk about if we ask whether CEUS is cost efficient or anything like this? So one question could be, should we do a liver ultrasound with or without contrast? We could try to answer this. The other question which I would prefer, which is easier to answer, is should we do a liver contrast-enhanced ultrasound or rather a liver CT or MRI? But again, this only applies to those situations where we might need them in these patients. And as I said to you, this is not always the case. The regular case is that we do not need any more intensive or more expensive diagnosis for the liver, simply because in patients freshly diagnosed with colorectal cancer, liver metastases at this time point are still quite rare, so that the benefit of doing more intensive diagnosis of the liver has not yet been proven. Okay, so when could we imagine that we could do liver contrast-enhanced ultrasound? One is we have done a liver ultrasound as recommended, and we have come across some suspicious or unclear lesion, could be hemangioma, could be anything else. In this case, we have to do something about this lesion. We could do this with CT MRI, or we could use contrast-enhanced ultrasound. The other case could be patients who, for other causes, have a very high risk of having more advanced disease, often because the physician who has done the colonoscopy says, well, this is a huge and very large tumor. I've done endoscopic ultrasound. He has a big infiltration depth. I know he has lymph nodes. And this high-risk patient, it might well be appropriate to do more intensive diagnostics. When we talk about costs, there are two views to look at this. First, if we have two methods which we believe are about equivalent, they are about as good, and this is the case presently for CEUS and CT or MRI. They have about the same accuracy, the same specificity, around in the same range. Then we can just look which of both methods is simply cheaper. This is a cost minimization analysis. The other thing is we have two methods, and we know one method is certainly better than the other one. We know that contrast-enhanced ultrasound is better than B-mode ultrasound, but it also costs more. then we have to weigh the plus in costs, which we know beforehand, again against the outcome of the patient. And this can be extremely complicated, as you may imagine. So how much worth in euros is 1 year life saved? How much in euros is worth if the patient is spared an unnecessary operations? These are ethical questions of which are to be posed. I'm not going to answer these questions within this talk. So, which possible aspects could apply? We could compare unenhanced liver ultrasound with CEUS. In this case, as I said before, we know CEUS is better than native ultrasound, and we would need a cost efficiency analysis, not a cost minimization process. The other question would be, should we do liver contrast enhanced ultrasound or liver CT or MRI? In this case, we assume they are about as good for the liver, and we could do a cost minimization analysis, and this is what I'm going to do in the coming minutes. The final question is, should we do a liver contrast enhanced ultrasound or rather a whole abdomen CT? Here we would have to assume, for some reasons, that CT or MRI are better than CEUS, simply because they include regions below the liver which are not included in the CEUS. And again, here we would have to do a cost efficiency analysis, and this is usually not done in colorectal cancer, except for high-risk patients, as I explained to you. Now, there are different ways of calculating costs. Commonly done are full cost calculations, and this is what usually is done in hospitals. They include simply everything. Buying the machine, loss of value of the machine, knowing that you have to buy a new machine in some years, maintenance rooms, staff, the doctors which are allocated, consumables. And when do you make these calculations? Mostly if you consider whether not or to buy an imaging modality. Are you going to buy a machine which is capable of CEUS? Then you do a full cost calculations, and you also do it, of course, in hospital for reimbursement calculations for what you get from the health insurers. The more simple questions are the by-case cost calculation. In this case, you assume that a machine is simply standing there. It is being bought, it's standing there for the next years, whether you order an examination or not. In this case, you exclude all those fixed costs and only include the consumables, the contrast agent, tear and wear of the machine, the staff which you need for doing the examination and which could otherwise do other things in the hospital, but you would exclude running costs like buying the machine, loss of value. And this is one of the calculations which you might do in private practice in case you have bought a machine and simply want to know, is it worth it doing the examination now or is it not? But if you're in hospital, be careful, because modern hospital management methods, they apply full costs and charge them to the departments which order a test. And again, this includes all room staff, tear and wear, loss and value of the machine and everything. So we have to consider full costs when we are talking now the next minutes. Where do the costs arise if we do ultrasound and contrast-enhanced ultrasound? These are data derived from the working group costs in the German Society of Ultrasound and Medicine. And you can see it very much differs. If you buy a machine, standard machine for ultrasound is 10,000 euros. It could be 100,000 if it should be capable of CEUS. You have to buy a digital storage device. You have stretcher. You need a seat to sit on. You have maintenance per year. These are costs which you have inquired. You have to pay for the room where it stands, and you have to pay for the staff. The doctor is, of course, only there when he does ultrasound. Otherwise, he's in other places in the hospital. There's a nurse allocated. You have to calculate the time needed for doing examination. You have to calculate the additional time you need for contrast-enhanced ultrasound, and you have consumables. Stretcher paper, gel, needle, syringes, and of course, one vial of Soneview, and this is the listed price which we have down here, 65 euros. The next question, which is important, if you have a capability of doing contrast-enhanced ultrasound, how often then do you do it? There may be a specialized department which only 100% of its time does only CEUS. I'm quite sure this is very seldomly done in this way, but this is one extreme. A specialized CEUS unit, 100% CEUS, 8 hours a day. Another scenario would be more commonly a department which does CEUS, does it quite commonly, but does it among others. The ultrasound unit is in use every day, a full day, so it's an ultrasound department, and 25%, or you can also calculate less, are contrast-enhanced ultrasound examinations, and patients are specially referred for this kind of examination. And there is another scenario which we could also imagine, which is quite uncommon again, a usual family doctor or an internist or maybe a radiologist who has an ultrasound machine standing there, but he has his office, he has to see his patients. So he only does ultrasound 1 hour a day, and in the rest of the time he does other things. The radiologist does CT, or the internist sees his patients and does other kinds of examinations, and he needs a CEUS only in a certain amount, in a certain proportion. And that proportion was calculated by the group, which I cite here, by 4% of all ultrasound cases. This is simply the estimated frequency of unclear liver lesions which you come across in ultrasound. You can do some alternatives, calculate 2 hours a day and 5% CEUS. So these are all variations of the same team. A doctor who is not specialized in ultrasound but does it a certain time during the day. What are the costs of the competitor of CT? These costs were drawn from the data from the German health insurers. This is what is reimbursed to a German radiologist. If he does a CT, it's 129 euros per examination, and the contrast agent calculating 150 mils of 300 gram per liter contrast agent. This is 45 grams of iodine, cost 95 euros. This is again the standard price, and this is again what is actually paid in private outpatient practice in Germany. This may be very, very different in hospitals, particularly if there are chains of hospitals of big companies. There you have negotiated prices, and they may be as low as 10% of the listed prices. So one dose of contrast agent costs just about 10 euros. This is reality in big hospitals. So what are the full costs per price? I will spare you all the calculations between which this group has done. So if you have a specialized department which only does CEUS 8 hours a day, the cost of a single examination is 122 euros. If you have a department which also does 100% ultrasound but 20% CEUS, it is a little bit more. Why is it more? Simply because there are fixed costs like buying a machine, which you do, and it only applies to a part of the examination. So the costs in plus which add to the standard ultrasound equipment apply more to these cases. And for this very simple reason, since this colleague here does only very few CEUS examinations, but he has bought the machine because it is maybe a hobby of him, he pays very much for this single examination. It's a horrible amount of money if you would do CEUS examinations in the private practice and buy a high-level standard machine only for CEUS. If you do occasional CEUS, 5%, again, it is quite expensive, 400 euros, and this is multi-phase CT. So the questions which we did not cover are, what are the cost aspects in individual cases? What happens if we use CEUS instead of unenhanced ultrasound? Here, what is relevant is the prevalence of metastases, the detection rate of unenhanced ultrasound and intraoperative ultrasound have to be taken into account, and of course the effect on patient outcome. We have not discussed the possible clinical impact of intraoperative CEUS, which is being explored, and of course we did not discuss the aspects of ionizing radiation. But still some very few words. Liver is not everything in an oncology patient. And beware of redundant examinations. You may not need a CEUS examination in a patient, who needs to have a CT or MR for other reasons. And there are many, many reasons why this might be the case. Locally advanced colorectal cancer, which requires a whole abdomen CT. Suspected lung metastasis, where the patient gets a chest CT and it easily extended over the liver. He might have retroperitoneal lymphadenopathy, which has to be cleared with CT, or other cancers, which I'll be talked about during the next minute. So there is a very simple method of cutting costs, and this is, please, just think ahead. Thanks.